Hello dear pharmacists and medical students. Today we are having a short discussion on diabetes mellitus. We will be seeing the medical for the medical students. We will be having a concise overview on diabetes mellitus. Okay, so let's start. So in this video mainly we will be focusing on the classification, the diagnosis, the management, the complication, the symptoms and the pathophysiology, that is how diabetes mellitus occurs. So we will be discussing all these points in brief in this video. Okay, so let's start with introduction. We all know diabetes mellitus. Okay, another name is hyperglycemia, that is a condition when our body is having more level of glucose than the normal level, right? This actually happens for the insulin, because the insulin is the main hormone that regulates insulin, and another hormone is glucagon. So mainly we are talking about insulin for hyperglycemia. Okay, this will be the hormone that is regulating our blood glucose level to keep it in normal range. Okay, but in hyperglycemic condition our insulin sensitivity in the body decreases, or the increase in the production of insulin decreases in the body. Okay, so either the production or the secretion, and the insulin sensitivity decreases in the body for some particular reason, and that's why hyperglycemia, that is diabetes mellitus, occurs, right? So we'll be seeing everything in brief. Okay, now hyperglycemia or diabetes mellitus, it is mainly occurring for insulin defects. Okay, that will be leading to organ damage and other complications as well. Okay, now chronic hyperglycemia is a condition that is defined when we are having hyperglycemic condition, that is glucose is more in our body for a longer period of time, that is called chronic hyperglycemia. Now when a patient is having chronic hyperglycemia, he may have this other diseases like other various organ failures, then kidney problems, nerve problem, heart, that is cardiovascular and other blood related problems. Okay, blood vessels shrinkage. So all of these things can be seen in chronic hyperglycemic condition. Okay, now if we come to the classification of diabetes mellitus, there are mainly two types, but other types are also seen. We will be seeing in this video, but mainly we will be discussing diabetes mellitus as type 1 and type 2. Okay, now in short, if I give you what is type 1, type 1 is autoimmune destruction of pancreatic beta cells. Okay, those are the cells that will be actually producing or secreting insulins. Okay, as autoimmunity, due to autoimmunity, these cells will be like beta cells will be destructed. So if the cells are not there, no insulin will be getting produced, and so there will be no insulin in the body and accumulation of glucose will be seen. Okay, next in type 2. Okay, one more thing also, in type 1 diabetes mellitus we mostly see this type 1 will be seen from the childhood itself in the patient. Okay, so that's why it is also called juvenile onset diabetes mellitus, that's because it is seen from childhood itself. Next we are talking about diabetes mellitus type 2. Okay, in type 2 diabetes mellitus, what happens, insulin production is good, insulin production is there, but insulin sensitivity, that is the glucose is less sensitized towards insulin. Okay, less sensitive towards insulin, that's why insulin will not be binding with glucose in good proportion, and so glucose uptake will be not there, or the glucose uptake will be less, and that's why glucose will be not reaching to the cells and glucose accumulations will be there in the blood vessels. Okay, next we can see gestational diabetes mellitus. In brief, if we are saying gestational diabetes mellitus is diabetes mellitus in the 4th week of pregnancy will be occurring in the lady or the woman. Okay, so this is another type of diabetes mellitus, but after delivery it mostly this gestational diabetes mellitus is eradicated from the body. Okay, it is not no longer persisting in the body. Next, other specific types will be, sometime it will be associated with some medications, or sometimes it will be some other disease like cystic fibrosis, pancreatitis or Cushing syndrome. These all can lead to other diabetes mellitus. Okay, next if we talk about the symptoms, like if a person is having diabetes mellitus, how we will be knowing that the person is diabetes mellitus? by seeing the symptoms, that are the clinical manifestations. Now for diabetes mellitus there are three solid symptoms. These are starting with poly means more. Okay, now polyuria, polydipsia and polyphagia. More urination, the patient will be more prone to frequent urination. Next, polydipsia means increased thirst. He will be drinking more water, and increased hunger, that is polyphagia. So these three are the solid pillars of the symptoms of what? Diabetes mellitus. Others are weight loss, blurred vision, slow healing. If a cut is there, it will be taking a too much longer time than a normal individual to heal in a patient who is having diabetes mellitus. Frequent infections, the patient will be more prone to having some infections. Okay, and fatigue, he will be feeling weakness. Okay, so these will be the symptoms of what? Diabetes mellitus. Now pathophysiology means how diabetes mellitus occurs in our body. For type 1, it will be, as I said, the beta cells. Okay, beta cells of our pancreas will be destructed. No beta cells, no production of insulin. Now how this get destructed? By the autoimmunity. So there is no solid pathophysiology. Because of the autoimmunity, beta cells will be destructed, and so type 1 diabetes mellitus occurs. For type 2 diabetes mellitus, what happens? No, insulin resistance will be seen. So initially what pancreas will be producing more insulin, so that whatever the sensitivity has decreased, this should be level up, or this should be coped up with the thing. But gradually what happen? No, these things will not work as expected, and what it is called, the sensitivity will be leading to decrease only. So with a longer time, the decreased sensitivity will be having, and glucose accumulation will be seen in the body. Obesity, inflammation and genetic factors contribute to insulin resistance. Okay, next there is one condition that is called ketoacidosis. Now ketoacidosis means uh, formation of ketone bodies in the body in too much portion, and that will be leading to the acidic condition of our blood. Okay, because ketone bodies are acidic in nature. This is called diabetic ketoacidosis. Why this happens means, when our body is not producing insulin, glucose will be started accumulating, so our cells will not have energy to use, so fat breakdown will be started in our body. Fat means it will be breaking down and producing ketone bodies, so more and more ketone bodies will be accumulated, and diabetic ketoacidosis will be seen. Okay, next is insulin resistance and diabetes. How do we get, like, whether the person is type 2 diabetes or type 1 diabetes containing? Okay, so for that we are having the diagnostic criteria. So for diagnosis we will be seeing two main things, that is normally what we are doing, that is fasting blood glucose level, and then is plasma glucose, that is blood glucose only, and another one is oral glucose tolerance test, that is postprandial. After 2 hours of eating we will be measuring the blood glucose. So there are two levels for this particular things. For fasting we are having the normal level of 126 mg per deciliter, and for postprandial the normal level is less than 200 mg per deciliter. So if the patient's blood glucose is more than that, that means the patient is having diabetes mellitus. One more important test is HbA1c, that is hemoglobin A1c. So this test mostly measures like how the for how long the diabetes is there in the body, and like what was the average rate for the particular, suppose 3 months or 6 months, like that. So this test is used to see if the medication is working on the diabetes patient for a longer time or not. Okay, so HbA1c test is for that thing. So these are the particular test we'll be doing to diagnose if the person is having diabetes or not. Now complications means, if a person is having diabetes mellitus, what other diseases or disorders he might have. Okay, now diabetes mellitus is a metabolic disorder. Okay, if this is there in some person, he might have so many other diseases like diabetic retinopathy, eyes problem, nephropathy, kidney problem, neuropathy, nerve problem, then macrovascular complications like he might have cardiovascular diseases, heart attack, stroke, peripheral artery disease, reduced blood flow to the limbs. He might have these kind of things. Other also he might have diabetic foot ulcers, increased risk of infections, erectile dysfunctions, fatigue. These all things will be coming with the diabetes mellitus. Okay, gradually the person will be developing these particular things in his body. Okay, next if we are coming to pharmacological therapy, as we have seen diabetes mellitus, its types, its symptoms, its diagnosis, its what else we have seen, complications, etc. Now we'll be seeing how to treat diabetes mellitus. Okay, now see, if a person is having type 1 diabetes mellitus, his body is not producing what, insulin, so insulin must be given to the patient. That is his therapy. So we can mostly get four types of insulin in the market. These are rapid acting, short acting, intermediate acting, and long acting, based on the action of their time of their action, like how fast they are acting. Okay, so insulin, there are four types of insulin, and inside these groups there are different types. Now oral hypoglycemics are those medicines they will be given orally to decrease the diabetes of some patients. Okay, so metformin, I hope you have heard the name if you are there in the medical branch. So you must have heard the name metformin, because it is a very commonly used medicine for diabetes mellitus. Okay, other than that, these are the different types of medicines given for diabetes mellitus. Sorry. Huh. So other than that, these are the different types of medications. So, like suppose sulfonyl ureas, how they will be working, they will be stimulate the insulin secretion from the pancreas. Thiazolidine, what they will be doing, they will be increasing the sensitivity of insulin. Okay, DPP4 inhibitors, what they will be doing, they will be insulin secretion, they will be increase and decrease the glucagon secretion. SGLT2 inhibitors, what they will be doing, they will be increasing the glucose excretion in the urine, so they will try to remove the glucose from the body. Next, GLP1 receptor antagonists, they will be increase the insulin secretion, decrease glucagon secretion, and slow gastric emptying. So like this all will be regulating our blood glucose level. Next, management. How can you manage the diabetes mellitus along with medications? That you should be having a regular exercise of at least 30 minutes daily. You should be decreasing your weight. If you are obese and smoking, you should not at all touch cigarettes. Okay, this is very dangerous for the patients who are diabetic. Next, diet. You should be having a healthy diet, decrease added sugar foods, cholesterol, and trans fatty acids foods. Okay, try to have some whole grains, fruits, vegetables, and lean proteins. Okay, so this was all about diabetes mellitus. I hope you got some new information about diabetes from this video. If you did, please hit the like button, and if you have any problem or doubts, let me know in the comment box. Thank you for watching.